In this video, we're going to go over the coxal bone, which is more commonly referred to as the hip bone. A couple of things just to remember. In Chapter 1, the hip region was the coxal region. So hopefully that helps you remember that the hip is the coxal bone. When you're talking about both right and left coxal bones, you'll call them the coxae. But again, just try to remember that it's coxal. If you call it hip, it's not the end of the world. One other thing as kind of background information, sometimes you'll see the pelvis, and we talked about like the pelvic cavity in Chapter 1. The pelvis just means you're collectively talking about the entire bowl shape of the pelvic region. You have both coxae as well as the sacrum and the coccyx. However, right now we're not worried about the sacrum and the coccyx because those are part of the vertebral column. And so we'll cover those when we do the axial division in a little while. One other thing before we move on to the directional terms is we won't often see a diagram like this. It almost looks like a mouse or some kind of mask where you have eye holes here and kind of big ears. We won't see this directly anterior view a lot. Instead, we're going to be viewing the individual coxal bone from the side. So we'll talk about that in just a bit too. The coxal bone is made up of 3 regions, so sometimes I'll ask you which region is that. These are the terms that I'm looking for when I ask for the regions. So take a minute to label the ilium, the ischium, and the pubis, and just know that these 3 regions have collectively fused to create that coxal bone. As I mentioned before, we're often going to see this lateral view for diagrams because it's easier to see all regions as well as each of the bony markings that we're going to cover. So to help you orient yourself with the coxal bone, whether you're using a diagram or the 3-dimensional bone model, these are some hints. So to tell you anterior from posterior, I would use the pubis. It comes to more of a point, so I think of it as pointing towards the anterior view, or remember that the pubic region was an anterior region in Chapter 1. The posterior is going to be rounded. Think of the butt, it's round, so the ischium has more of a C shape or a curve to it, so that will be your posterior end. As I mentioned before, these will be our common views when you use diagrams. So right now you're looking at them, the lateral view versus the medial. The lateral view always needs to show the acetabulum. So this will be a bony marking I'll cover in just a bit. But when you see this kind of circle indent, that means you're looking at the lateral side. The medial side needs to be smooth. You don't want any bony markings interfering with the internal organs of your pelvic region. And then for superior versus inferior, making sure you're directing it upwards, I would use the iliac crest. You can see it from both views. The iliac crest is kind of like the crust on top of your bread, and the ischium is going to be kind of, again, that lower inferior portion. Moving on to the specific bony markings on the coxal bone, the acetabulum is what I would always start with because it's going to help you find that lateral view. And again, it's always lateral because it articulates with the femur. So in order to make that ball and socket joint work, we need this acetabulum to point laterally. Another thing, not a huge deal, but the acetabulum does not belong to one specific region. So we will see a couple bony markings that are specific to one region. This one, as you can tell in the color codes, it's a little bit ilium, a little ischium, a little pubis. So I might ask you something like, does this bony marking belong to one specific region? You would say no, it's made up of all. Obturator foramen is the first time we're seeing a soon-to-be common bony marking, foramen. Foramen is always going to mean that it's a hole. So this foramen is a hole that's a passageway for blood vessels and nerves. It's also a common site for muscles to attach on the ridges of it. So we'll see foramen several more times, and I think of it as amen is a holy word. So whenever I see foramen, I'm going to look for a hole that leads to some sort of passageway in the bone. Similar to the acetabulum, the obturator foramen is made up of both the pubis and the ischium. Moving on, the ischial tuberosity is found on the ischium. I can't give a good reason of why bony markings change from ischial to ischium. Just go with it. But the ischial tuberosity is a bump off of that inferior posterior region. This is what you feel if you say somebody has a bony butt. This is your sitting bone. The ischial spine is also on the ischium, and it comes to more of a point. So it's more of like a little hook off of the inferior posterior side. Muscles will attach here that help with kind of the pelvic floor. And the iliac crest is going to be that superior marking. Similar to the anterior crest on the tibia, you can feel this when you put your hands on your hips. It's that kind of sharp ridge of your hip bones. So use this to indicate that superior direction and watch for muscles to be attached here later. Those are your bony markings of the coxal bone.